joined by Dr. Ramjar, who is a local GP here in Ashton and also Clinical Director for Tameside and Glossop. Here at Oxford Park, the largest vaccination centre now up and running in Tameside. Tell us how the process is going, how long it's been working, how many people have been vaccinated, Ram?
Everything is going all right at this moment. We have vaccinated more than 10,000 in this area, but we have started with Hyde first. It was drive-through, and we have started this centre from in January after 10th, and since then we have done about 5,000 here. This centre.
Just at this centre?
Yeah, from this centre.
Because you can get through more than 1,000 vaccinations a day here.
Yes, that's correct.
So really it seems the only thing that's limiting you is perhaps the number of vaccines that arrive.
Yeah, you are correct in this. We have got capacity to do 2,000 of AstraZeneca vaccine, and we can do up to 1,300, 1,400 of Pfizer a day. Now, we have set up in a way that we can vaccinate all 7 days if needed.
Okay. Can you just give us an idea of how the system works, how it operates here, when people arrive, how they register?
Yeah. So first of all, when people arrive, we have looked into that they will be coming by car. So we have got about 40 car space in front, and we have got about 60 car space in the back. So those who are driving, they just park the car in front, and those who are passenger, then we ask them to wait behind our vaccination center where we have got 60 spaces. So we don't have any worry about parking. Once they arrive, they come at the door. We have got marshals. They direct them where to go. When they enter the hall, their temperature is taken. They are given gel to clean their hands, and they walk through. Then somebody registers at the gate, and then come and go to the administrator where all details are taken. They are checked that they have been booked or not. Then after that, they go to vaccinator where they take full history and see the suitability of the patient, and then we vaccinate them there.
Okay, and there are different sitting areas, aren't there, for people who are being vaccinated behind us?
Yes.
And then if they are driving, they wait for 15 minutes.
That's correct. So it's different for both vaccine. In Pfizer, everyone has to wait for 15 minutes. So in Pfizer, we have different setting where 6 of them vaccinated at the same time, and we record the time, and after 15 minutes, we let them go. But with AstraZeneca, they can have vaccinated and they can go straight away. But those who are driving has to wait 15 minutes. So we have segregated this area into 2 parts, one where they're vaccinated, and those who are driver are waiting for 15 minutes in other part.
Okay. Now, remind us about the 4 groups, the 4 important groups that are being vaccinated first, and where we are in Tameside with that at the moment.
The 4 group is mostly above 70. We are vaccinating everyone with care worker and health worker and care worker. Mostly they are being vaccinated in hospital setup. But first is above 80. We have reached about more than 90%. Above 80 we have vaccinated. We have vaccinated all care home residents. That was our target, most important target, because they are the ones who have suffered a lot in this COVID. So we have done almost 99% of our care home residents now. Then the second group was above 75, we have done that. And now we are doing the 70 with extremely vulnerable groups as well. Yeah.
Now, it's not. There's been a huge take-up for the vaccine, which is good and positive, but there are some people who are nervous, aren't they? And perhaps not coming forward. Do you have any words of reassurance for them?
Yes, certainly. In our area, what we are noticing that we are doing very well with few groups, but especially Muslim community are not coming forward at this moment in our area, and I think we need to go and they, I don't know why they are not. There may be some reservations, and we need to talk to them and discuss with them. But so, on an average, I will say when we started this program, I was a bit skeptical that not many people will come. I was thinking 50-50, but it's not the case. Lots and lots of people are coming, but still there are some people who are not coming, and we need to educate them in a slightly better way so that whatever their worry is, we can discuss with them, we can convince them, and they can come and get vaccinated.
And for those who are coming, are you finding that most of those people are very grateful because it will give them an opportunity to come out of lockdown and see family and friends again, won't it?
Yes, I think so, but you are in a better position to ask them and give us feedback, because we do our job to our best resource, and all our dedicated people here, they go extra mile to help patients, but still we will need to have some feedbacks.
Hopefully we'll get some of that while we're here.
Sure.
But also for you as a local GP, this must have been the most challenging time you must have faced in your life, I guess. Just give us briefly sort of an idea what this last year has been like for you, and also what the vaccine has meant.
Okay, last year was terrible for us, okay, and our patients as well. We went through a lot of lockdown. We had a lot of patients worrying about their health. In a way, our chronic disease, they also suffered. Our cancer care suffered a bit. We were trying our best to do whatever we can, but certainly these are the areas which we were very worried about. And on top of that, in December, we were one of the highest COVID deaths in the country. So all the clinical directors of Tameside and Glossop sat down, and we decided the only way forward is vaccination. So we started doing vaccination a bit early than other areas of the country, and that's why we are about 2 weeks ahead of other areas of the country. So I think only way forward for our patients to get vaccinated as many as they can, and then I think that we'll be back to our normal days.
And so finally, for those people who, because we're focusing so much on the vaccination programme now, for those people who have other ailments and other illnesses which can be serious, would you still encourage them to get in touch with their GPs?
Yeah, those who have got serious problem, these two vaccines are doing well with them. Only those who are allergic to component of this vaccine can have allergic reaction. But most of the antibiotic reactions people are worried about. But these two vaccines are recommended for any allergic reaction to any antibiotics. So I will encourage people to come and get vaccinated. Similarly, chronic disease patients, they also need to come and get vaccinated. Only way forward is the antibodies against COVID in their blood. They can fight it out better with these vaccinations.
Well, Dr. Amjar, thank you very much.
Thank you.
I'm joined by pharmacist Ashton Khan. Ashton, you've been a pharmacist for how many years?
About 8 years.
About 8 years. And tell us a little bit about your role in the community and what you actually do as a pharmacist.
Okay, so at the moment I work in primary care, which is based in GP surgeries. My role is working alongside the GPs and other pharmacists in the same field to deliver care to patients. So at the moment we're doing reviews on people of certain frailty and those in care homes as well. We're also, as you can see, we're working in the COVID vaccination centre as well, so our role has changed dramatically since December.
Right, and also, I guess, in terms of your role, since the start of the pandemic and that very first lockdown last March.
Yeah, so we went from being face-to-face and seeing patients to over the phone.
Okay, well you've been very kind enough to show us exactly what your role involves here at the vaccination centre in Ashton, and which is making up the vaccinations themselves for people.
Yes.
So yeah, if you could take us through that process.
Okay, so today we're working with the AstraZeneca vaccine. What we do is, with this one it's a bit more simpler than the Pfizer one. So this one you just draw up doses from it. But it's quite important to wipe down after every time you draw up. That is because this vaccine does not contain any preservatives, so it basically means that microorganisms can grow inside it if we're not careful. So what we do is take a syringe. We draw it up to 0.5 mils, which is the dose of the AstraZeneca vaccine.
Mm-hmm. How many of these are you doing a day?
Today we've got 1,200 patients booked in. Yeah, so we will be doing 1,200 syringes drawing up.
So although we're quiet here for the purpose of this video, it's going to be it's kind of non-stop in here, isn't it? All day long.
Yeah, it is. Yeah.
And how many other members of the team do you have?
We have 5 in total.
Right.
So
okay.
yeah.
And
We do need them all.
And do you manage all of them?
Yeah, so I'm the lead pharmacist for the Ashton area.
Okay. So what? Yeah. Okay. What happens next? We've got to the.
So I would normally have a double check here,
Right.
but there's no one in the same room as me. So that is, it would come down to 0.5. What I would do is take it out,
Okay.
pop it in there. That's it, and then I would write down the time that I've punched the vial because it only lasts 6 hours from the first puncture.
Okay.
That's just to prevent any microbial growth as well in there.
Right.
So the time's up there, sorry. So that's 13:09. So we know from 6 hours from this time it needs to be used up. So we
Now,
write
I was
time
aware
down.
of the timing for the other vaccine. Are they the same? Do they have the same shelf life?
Yeah, so this one, once punctured, it's 6 hours. That's the same as the Pfizer, but the fridge life of this one is a lot longer. So they have an expiry date of about a few months, so this one expires in around May time. Whereas the Pfizer one, once it's out of the freezer, it only lasts 5 days.
Right. Okay. So once you've got the syringe ready, what happens next?
We pop it in this box, we just line them up.
Okay.
There's
How many
10.
go in there?
10 go in there.
Right.
Yeah, and then they're ready to go out to the vaccinators.
And then the nurses and the care staff
Yeah.
take them to the patients.
Yeah.
Okay. So long days?
Long days, yes, very long days. We start about 7 o'clock in the morning, and it's normally a 12-hour shift.
Right. Okay. And yeah, it's an early start. What's
Yeah.
it feel like though to have been part of all of this?
It feels amazing. I didn't think that we would ever be part of something like this. Yeah, it feels really rewarding as well to be part of it. Everyone that comes in is so grateful for what we're doing. Yeah, they do understand that it's quite a big mammoth task. What we're doing is massive. Yeah.
Yeah, and as a pharmacist, somebody who looks after patients, perhaps before they go to the GP anyway, really trying to get the message out that although people might be nervous about having the vaccine, they really should come along and have it. It is okay and safe.
It is very safe, yeah. And if they've got any questions, they can always ring up and ask, or go to your local pharmacy, or ring your PCN pharmacist at your GP surgeries to ask any questions.
Well, Ashton, thank you very much, and for all the hard work you're doing, especially for us all here in Tameside. Thank you. Okay, I'm joined now by Dr. Martin Stagg here at the Oxford Park Leisure Centre, where the vaccinations are continuing. Dr. Stagg, you are recently retired GP.
Yes,
you've
October,
come
yeah.
here as a volunteer. Tell us first about where you practice and what you did as a GP.
Yeah, I was in Albion Medical Group. I was there in that building and the one next to it for 35 years in Ashton. So I was a GP.
Yeah.
It was a training practice. So we had registrars there and the whole support group that you'd expect in a large general practice.
Okay. And you retired last September?
The end of September, yes.
Okay, and that will have been a rather different retirement then.
It was extremely quiet. It was extremely subdued, and I kind of had to sneak out the back door a little bit. We couldn't really advertise it to patients widely because it was difficult for them to get appointments or come in. I've obviously got to know lots of patients very well over the years, but we couldn't really do a big retirement function in any sense, and that meant the practice being closed except for telephone calls and then arranged appointments. you couldn't have lots of people calling in, even to wish you goodbye or thanks. So it made it a little bit awkward and difficult.
And also, if you were practicing still last year,
Yep.
At the beginning of the pandemic, and throughout lockdown, the first lockdown,
Yes.
that must have been a very different sort of experience as a GP. What was it like
yeah.
for you?
There was a lot of change necessary very quickly. As a practice, we've generally done face-to-face appointments, a few telephone appointments on a daily basis that were booked, but really in the space of 2 weeks or so we switched to nearly entirely telephone appointments and then bringing people in one by one that needed to come in after speaking to them. That was a big change and it happened very quickly for patient safety and safety of staff. So it's massive alterations in how people worked, but you did it very quickly and still trying to work very hard. In fact, the total number of patients that we were dealing with by phone was greater than the ones that we were seeing face to face in the previous year. But I think the perception from patients was, from many surgeons, was that it's hard to get in and that GPs aren't open, but they're very much open and we're very much working as hard as normal, but you just couldn't see it.
If not harder, really.
Yeah, if not harder.
Yeah.
And it was quite stressful for everybody. Yeah.
So now the vaccination programme is underway, and you've become a volunteer. When did you decide to do that?
At the end of December, I saw Dr. Jar and I spoke to him, and he was telling me they didn't have many volunteers for some sessions, and actually it's my other half, who is a medical rep, who actually said, I'd like to volunteer, and I said, well, I'll volunteer with you, why wouldn't I? So we basically both volunteered on the same days since we've been, so I think it's our fourth session. So it's just whatever we need to do, really.
And so what kind of things have they got you doing here as your role?
Well, my role, I'm no longer, because I'm still a doctor, but I'm no longer registered with the GMC, so I'm not allowed to administer medicines as such. So I'm not doing vaccinations, but I'm here to provide just general support and backup and help for people. I'm not doing clinical things most of the time. In fact, I'm just seeing people to the chairs and advising, but patients do have queries and the staff do have queries, and they know that I'm a former GP, so I can answer a lot of their questions and help. So I'm not doing specialised medical help, I'm doing just anything help.
Okay, and how impressed have you been in terms of how the programme has been operating and the number of vaccinations that there have actually been here at Tameside as well?
Dr. Jar in particular is extremely well organised, and he's set up some brilliant systems. He's very good at micromanaging the systems. He's done a very good job of it. It's really impressive. And in fact, the setup today, if you've been here before, is different to how it was yesterday, because they're doing a different vaccine today. They're doing the AstraZeneca one today, whereas the Pfizer one is a bit different, and how you deal with the patients is a little bit different.
Okay. And as a volunteer, how long will you be here for, in terms of hours in a day?
Hours in a day? I think today we're just here from 8 till 2, officially, but we'll see how busy it is at 2. We were doing volunteer stuff at Hyde, and sometimes it was up to 10 hours or more there at Hyde outside. So that was so it's a pleasure to be in here.
Indoors.
Because it's warm and dry and nice. Yeah.
And what's the reaction from most people who are coming for their vaccines? Are they delighted to see you, or some nervous?
Yes, most people are extremely pleased to be here, and you get thanked a lot more than in general practice normally. It's very visible what you're doing, and they're very happy to be here. A few people are anxious about vaccines, same as you'd expect at any time. But the staff are quite experienced and quite skillful in dealing with them.
Yeah, okay. Well, Dr. Martin Sack, thank you for being part of it.
It's all right.
And thanks for talking to us.
You're welcome. Take care.
Anything else you want to say?
No, not really. It's just that everybody's working really hard. It's the volunteers, it's paid staff, but everyone's good. The atmosphere is great, and the patients seem to appreciate being treated civilly and by people who are in a good mood. I think they like it. Yeah. Okay, thank you.
I'm joined by Nick Coates. Nick, you're here on the door with the responsibility for everyone coming in.
Yes.
First of all, as a volunteer, tell us how you got involved.
I got involved through a friend who's a friend of one of the nurses, and we just wanted to do something to help out. and try and get the vaccine to all the community, local community.
And how long have you been here as a volunteer now?
This is my second day, but I'll be coming next week as well.
Okay. And in terms of instruction that they've given you, have you just had this one role on the door to do?
I have other roles, cleaning the chairs, just showing people to the seats, and just accompanying people, anything that's needed other than medical, whatever is needed for the community.
When we say you're on the door, it does involve meeting and greeting,
Yes.
reassuring,
Yes.
but also that everyone's got their hand gel,
Yes.
and you take everyone's temperature as well.
Temperature as well, because that's important to make sure everybody that comes in, if the temperature's high or abnormal, I can tell one of the nurses and they can make a decision on where to proceed from there. I try and tell people where to go, introduce the son to the nurses, and let them get the injection as quickly as possible.
And what's it been like for you to have been part of all of this?
I think it's fantastic, I absolutely love it. I love helping out and trying to do things for the community and helping people and just making sure people are safe when they come in and the people that are already in are safe.
Because everyone might think it's just the health profession, but if it wasn't for people like you helping out as well, it wouldn't sort of all work and gel together, would
Well,
it?
if I wasn't doing it, it would mean the health professional would have to stand at the door and it would take up valuable resources.
Well, Nick, thank you for the wonderful job you're doing.
Thank you.
And helping out here in Tameside,
Thank
where
you.
the number of vaccinations is certainly leading the way
Yes,
in the country at the minute.
it is.
So thank you.
No, thank you.
I'm joined by Brian Johnson, who's a member of the Duckingfield Congregational Church and also here at the Oxford Park Leisure Centre helping out as a volunteer. Firstly, Brian, tell us how you came to be a volunteer here and helping.
Okay, well, we have a good friend who's a nurse who was helping set this centre up, and she put it on our WhatsApp site that we have at church, asking if anybody would be willing to donate a few hours just to help out, which I willingly did, thinking, I'm just doing my bit really to get rid of the pandemic.
Yeah, and how many sort of hours are you doing a day? Because it's a very long shift for members of the staff.
Yeah, it is for members of the staff, yeah, but as I say, I'm a volunteer, and I committed myself to doing a couple of days, 12 till 4, a 4-hour shift.
And in terms of training, what have they got you doing?
Well,
and how long did it take them to show you what to do?
Oh well, with me being highly intelligent, it didn't take that long. But I'm doing the basics, to help the professionals out. Really, I clean the chairs, I show people where to go, just try and keep spirits up, and that's it really.
Yeah, we saw you helping on the door and greeting
on
people
the door,
as well.
all that stuff. Yeah.
And encouraging people to sanitise.
Yes.
And what's it felt like in terms of now this centre is up and running properly? They're vaccinating up to 1,200 people a day. In fact, they could vaccinate more if they had more
absolutely.
vaccines. What's it feel like to be part of it all?
It feels, I feel encouraged that I've been able to do that, and feels satisfied that I've done my little bit towards the end of the pandemic really, although it be a little bit, it's a little bit. Yeah.
That's great. Thank
Okay.
you very much, Brian.
Thank you.
Indeed. No, thanks for
Have
what
a
you're
good day,
doing.
boys.
Thank you.